So today on Gentle Dental, I am joined by Dr. Emily Taylor, the owner of Pediatric Dentistry of the Ozarks in Rolla, Missouri. Dr. Taylor is a Missouri native who's been caring for little smiles for nearly a decade. She's earned her dental degree from UMKC, and she went on to complete her pediatric residency and master's degree at Riley Children's Hospital. Board certified since 2017 and currently serving as president of the Ozark Dental Society, Dr. Taylor is as passionate about patient education as she is about making kids feel safe and cared for in her practice. She's here to share her experience and expertise on everything that you need to know about your child's first visit to even more complex situations like in-office sedation and how to make the dentist a positive experience for the whole family. Dr. Taylor, can you introduce yourself and share your background?
Yeah, thank you for the nice introduction and thank you for hosting me. I'm excited to be part of this program. So, as Dr. Chinnery said, I'm Emily Taylor. I'm a board certified pediatric dentist. I've been practicing in Rolla for over 8 years, and I really love being part of the community. My husband and I live with our two kids in Newburgh, so not too far from where I practice, and I've really enjoyed being part of the community over the years.
So, why did you pick pediatric dentistry and what led you to opening up your own practice?
Yeah, that's a great question. So I chose pediatric dentistry for a number of reasons. In dental school, I witnessed so many adult patients who were outwardly very scared or disliked coming to the dentist. And I thought if I could start with children and make it a positive experience coming to the dentist, that would help them be happy dental patients for the rest of their life. Our pediatric patients are also so much fun. They always keep me on my toes. I really love their honesty, their humor, and their genuineness. I also love the technical aspects of pediatric dentistry and working with my hands to improve children's health. So, owning my own practice has also allowed me to be able to treat patients the way I would want my family to be treated. I chose to open my own office with a lot of encouragement and support from my husband, our families, and my friends. So, I'm just very lucky and pleased with how our office has grown, and definitely couldn't have done it without all the people that were with me on the journey.
You have a great support system.
Yes.
Can you walk us through a little bit about your training after dental school?
Sure. So after 4 years of dental school, I applied and was accepted into a 2-year specialty residency program for pediatric dentistry at Indiana University, which is affiliated with Riley Children's Hospital. I really loved that our program not only had didactic lectures and classroom courses to help us understand the science behind pediatric dentistry and best practices, but we also gained a lot of clinical experience as well. So at Riley, we treated children with a wide variety of healthcare needs, and our training included several rotations through different hospital specialty clinics with interdisciplinary training, which was really invaluable to me to see what other healthcare providers are doing in the hospital. Some of our rotations involved working with the cerebral palsy clinic, anesthesia department, the cleft lip and palate team, and their neurodevelopmental program for children as well. We spent a significant amount of time treating pediatric patients in the operating room at the hospital. And as residents, we got to rotate being on call for Riley Hospital in the emergency department. So we got experience treating trauma cases and collaborating with other specialties on those. And then while I was in residency, our program also had a master's program. So all of us residents, we got our master's during our residency as well. So I was really fortunate to also have a lot of great attendings who worked with me, get a lot of different perspectives and, different things that they taught me. And some of them were renowned speakers and authors in the field. So it was a really overall great experience.
That's awesome. Can you tell me a little bit about the difference between a pediatric dentist and a general dentist?
So a great way that I've heard it explained is that pediatric dentists are kind of like the pediatricians of dentistry. So we're specialists who have chosen to limit our practice to working with children, and we're focused on helping them have positive experiences and building lifelong healthy smiles.
That is great. Is there a specific age range that you do treat?
We will see children as young as they come if they have oral health concerns. So we see infants and newborns in our office. The American Academy of Pediatric Dentistry recommends that a child should see a dentist no later than age 1. So at these visits, we're focusing on a healthy start to oral health, showing them how to brush their child's teeth, talking about eating and drinking habits, and what to expect in their dental growth and development. Early trips to the dentist early on for preventive care really do help avoid dental problems and can save a lot in treatment costs that could potentially be incurred later on. And there are studies that have shown that children who had their first dental visit by their first birthday were less likely to need fillings or other dental work later on. So we definitely recommend establishing care early. And then whenever our patients are old enough that they are emotionally mature and they have their adult teeth in, and they're ready to graduate to a general dentist, somewhere in the teenage years, we usually start having that conversation about them graduating to a general dentist. And it's a little bittersweet for us because we miss seeing our patients, but we're also excited for them that they're moving on to that next phase of life. But it's really fun to watch them grow.
So if someone has any special healthcare needs, is there a certain age where potentially you could see them into their adulthood?
It depends on their treatment needs. So for some patients, it makes more sense for us to refer them onto a clinic that or an office that's more equipped to treat the needs of adult patients with special healthcare needs. There are certain resources that we have available, but sometimes they will need different levels of sedation or treatment for permanent teeth that we're unable to provide to them. So it's just a case by case basis discussion with the caregivers and patients to decide what's the best fit for the child going forward.
How often should a child see you as a dentist for checkups?
So we highly recommend that children come to the dentist every 6 months. And this really allows us to detect and treat any dental problems early on. So a lot can change in 6 months, especially in baby teeth and with children.
Can kids see a general dentist, or should they see a pediatric dentist if they're under the age of 12, let's say?
So kids can absolutely see a general dentist, and there are many who are great at working with children. Pediatric dentist is generally going to be very comfortable seeing children of all age ranges. Some general dentists may not feel comfortable meeting the needs of some of their pediatric patients. For example, if they are not able to cooperate for treatment, or if they have special healthcare needs, or if they need sedation or anesthesia, or if they're a younger patient that is not likely to cooperate for an exam, that just may not be a fit in their practice. And that's the things that we're here for to help those patients.
I will still say it's nice to have that option to refer to you guys, but sometimes there's kids that they will act and sit better for treatment than 70-year-old adults. So, like, it just depends
Yes,
on the kid.
absolutely. Yes.
How should parents brush their kids' teeth at home?
So when a child can hold a toothbrush, I think that's a great time for them to also get interested in, brushing and learning how to do it. In the early stages, definitely need to brush your child's teeth for them. There's ways that you can help stabilize them so you can safely and effectively clean their teeth. We always make it a point to demonstrate that for parents at their visits if they're having challenges so that they have tools at their disposal when they're at home. We always emphasize that you're not traumatizing the child by brushing their teeth, even when they're not a big fan of getting their teeth brushed. It's just another hygiene practice like changing your diaper and things like that. We do it because that's part of good oral health. So as kids get more interest in brushing by themselves, it works really well to let them have a turn and then the adult gets a turn to brush the child's teeth afterwards. Children generally need help brushing until they're old enough to tie their own shoelaces, but some still require additional help even beyond that age, depending on their risk for cavities and their ability to get back there and do what needs to be done. Kids need to have their teeth flossed, generally speaking, when any two teeth are touching. So sometimes this is right when their teeth come in. They don't have any space between their little baby teeth and you need to floss. Other times it's when they're a little older and more teeth start touching. But generally, if you cannot see an open space between your child's teeth, then you need to be flossing between the teeth in those areas.
What kind of toothpaste do you recommend, and how much should you use depending on the age?
So in my practice, I usually recommend a fluoride toothpaste as soon as the first tooth erupts. And we recommend limiting the amount of toothpaste at different stages so that it's not harmful to the child. So the general rule is that but for children less than 3 years of age, just use no more than a little smear or a little grain of rice size amount of fluoride toothpaste. That way, if they do ingest it, it's not harmful. Some families, I'll recommend just taking the tube of toothpaste and kind of squeezing it up so you can see a little bit coming out. And then you'll just take the toothbrush and dab the bristles in there and brush with that amount. We graduate to a pea size amount, which is recommended for children once they reach the age of 3. And we also recommend that they learn to spit the extra toothpaste out.
How often should they be brushing?
We recommend twice a day. Nighttime is going to be your most important one. If you forgot the morning one, make sure you get that nighttime one in there because we don't want any plaque or debris sitting on the teeth overnight that the cavity causing bacteria in our mouth use to make acid on the teeth, which is what causes the cavities.
And is there a difference between the fluoride treatment that you get in the dental office versus the fluoride in the toothpaste that you recommend?
Great questions. Toothpaste, we know, is kind of meant more for daily use and is a lower concentration of fluoride that's safe and effective for use at home. Brushing with fluoride toothpaste is going to help significantly reduce your risk of cavities. Fluoride treatments in the dental office are going to be applied by a professional. They do have a higher concentration of fluoride, but still a safe amount, and they have a prolonged contact period with the teeth. So those fluoride treatments are going to help promote remineralization of the enamel, which is the outer layer of the tooth that you see, and it's going to help make it more resistant to developing decay or cavities.
What is SDF or silver diamond fluoride? How do you use it? When do you use it? And how does it work?
Generally speaking, silver diamine fluoride, SDF, is an antimicrobial solution. So it's professionally applied in the office. It's not a take home. A dentist will apply it for you. And it's designed to slow or arrest the growth of cavities. So it works by killing the cavity causing bacteria and in some cases can help remineralize the tooth structure. So we use it for children who have small cavities in between their teeth that don't necessarily need a filling at this time or a crown at this time. And we're trying to see if we can get those to stop growing or slow the growth of those areas. We also will use it as kind of a temporary placeholder for families who may not be able to afford more definitive treatment for the child at that time. It will stain the teeth so that aesthetics are a bit of a consideration when having that discussion with families. It's about 70 to 90% effective, so it can be very effective. It's very non-invasive, but it does have some aesthetic concerns that can come along with that. For example, if a child has a cavity on a front tooth, it will become very noticeable. It turns the cavity a dark black color, almost like you took a pen and colored it in. Now, if you have cavities on the back teeth, most people, generally speaking, are probably not going to notice that unless you open your mouth really wide and you're looking back there. When we apply it, it's very easy to apply. We dry the tooth and then we paint the medicine or the silver diamine fluoride on the tooth and let it set for about a minute. And then we wipe the extra off. That's about it. So they're good to go.
And how often do you have to apply it?
So that really depends on the patient. For some patients, we'll recommend doing an initial dose, and then we will do one again in 3 weeks. We're looking to see how effective it has been or see if we can see clinical signs of the medicine being effective. We'll often reapply it at that time, and then we'll reapply again in 3 months. And if there's 6 month checkup, we'll take a look and see how well that's working for the patient. And at that point, decide if we want to continue doing maintenance doses. Sometimes we do those every 6 months. Sometimes it's once a year, depending on the risk level for the patient and how effectively it's working. For patients where it's not working as effectively as we would like it to, we may turn our conversation more towards definitive treatment for the child so that we can avoid the cavity from growing extensively and starting to cause the need for more invasive treatment.
What are baby root canals and why might they be needed?
So another term for baby root canals, or what people are often referring to when they ask about baby root canals, are what are called pulpotomies or pulpectomies. Those are different types of nerve treatments for the tooth. When we do a pulpotomy, that's meant for a tooth that is showing signs that we can remove part of the nerve tissue and put some medicine inside. And we're trying to keep that tooth alive and in the mouth as long as possible. So in those cases, we remove part of the nerve, the top layer of the nerve of the tooth. We put a biocompatible medicament or medicine inside the tooth, and then usually those teeth benefit from being restored or fixed with a crown of some type to cover and protect the tooth. Pulpectomies are meant for teeth that need a little more invasive removal of the nerve of the tooth. There are bacteria that have gone into the nerve to cause a problem. That portion of the nerve that's down into the roots, not just the top part, like in a pulpotomy, the pulpectomy goes down into the roots of the teeth, and we remove the nerve. You put a material in there that will dissolve or resorb as the baby tooth is ready to come out on its own.
When would you recommend the silver caps or stainless steel crowns? And are there any other options if the tooth needs one in the front?
I usually recommend stainless steel crowns for a few different reasons. So, one might be if the child is very high risk for developing cavities. Whenever we place a filling in the tooth, that leaves part of the tooth exposed where the child can get a new cavity around the filling or on a different part of that same tooth. So, a stainless steel or silver crown can be a more definitive or long term option for those patients. If we know that they're going to keep that tooth quite a while longer, that would be potentially another reason to place a crown, a stainless steel crown on the tooth to cover and protect it. We mentioned nerve treatments earlier. If a tooth has had a nerve treatment, oftentimes it will benefit from having a stainless steel crown. When we're looking at front teeth, obviously families usually want something more aesthetic in the front. And so we have zirconia, or they're all ceramic or porcelain crowns for the front teeth. They're very durable, very aesthetic. We frequently offer those for our patients.
So they're a little bit more tooth colored than the silver caps.
Yes, they have a very natural or lifelike look to them and blend in very nicely with the primary teeth or baby teeth.
Does it really matter if we remove a baby tooth early?
Baby teeth are important for lots of reasons. One of the reasons is that it's going to help hold a spot open for the new permanent tooth to come in. That's especially true in the back where things tend to want to shift and drift and rotate if we don't hold that space open. So in some cases we can place a space maintainer if a baby tooth has to be removed, but keeping the natural baby tooth in many cases is preferable when possible. As far as front teeth go, past a certain age, we don't worry as much about losing space in the front. Parents will ask about aesthetics, which I can understand, being a concern for families. Most normally developing children we find don't tend to have problems with speech development even when they do have to have teeth removed, and they tend to be very adaptable and resilient even when a front tooth has to be removed.
For a space maintainer, is it something that can be done the day of an extraction, or does the parent have to come back after like a lab makes one, or how does that work?
It depends. So, whenever we're removing a single tooth, oftentimes we can place a space maintainer the same day. However, in certain cases, depending on which tooth is removed, we may have to make a model of the child's teeth and send that to the lab for them to fabricate a special appliance for them that's custom.
When do you usually start taking x-rays on kids?
It depends on their risk factors and their age. So, they're definitely prescribed by the dentist based on the child's needs. Things that would indicate a need for x-rays would be if the child has had any trauma to the teeth or their mouth, if we're checking something growth and development wise, if we're looking for decay or screening for pathology. In general, on back teeth where we'd have to take the bite wing x-rays that check for cavities in between the teeth, we call them our cavity detecting x-rays. Usually those are indicated whenever you cannot see in between the baby teeth any longer. So without those, there are some cavities that we can't see just by looking with our eyes.
Can you talk about like how does in-office sedation work for kids?
So there's varying levels of sedation that are available for children. In our practice, we use nitrous oxide. So it's a very minimal form of sedation where the child is still awake and responsive throughout treatment. They're breathing through a little nose that has a concentration, a variable concentration of the laughing gas or nitrous oxide that helps them just feel a little bit more calm and comfortable during treatment. For some patients, it can help reduce their gag reflex as well. And then we also offer in our office-based general anesthesia. So it's the same general anesthesia you would have in a hospital setting where if you were to have tonsils and adenoids taken out, ear tubes put in, where our patients go all the way off to sleep and their dental care can be completed in a very safe and non traumatic way.
When would you recommend sedation?
Sedation or anesthesia is ideal for patients who are fearful or anxious to the point where they're not able to tolerate treatment being awake. Some children who are pre-cooperative, not able to cooperate for treatment, if they have special needs, more extensive treatment needs that would require multiple longer appointments for the child, where they may get kind of burnt out, so to speak, on treatment. And this is just a nice, safe, and non-traumatic way to get everything done at one time.
When and why do you send kids to the orthodontist?
We usually start screening for orthodontic treatment needs very early. So, for example, if I see a young child that comes in 4 or 5 years old and they have no spacing between their baby teeth, in fact, they may have some overlapping of the baby teeth or crowding, I usually start kind of preparing the parents that there's a good chance that your child may need braces or orthodontics in the future. Usually around age 7 is when we make that initial referral to the orthodontist. That's what the American Academy of Orthodontists recommends, that the child be seen around age 7 for that initial examination to establish care. And the orthodontist may say, let's wait on treatment or let's do an early phase of treatment. I usually leave that up to the professional judgment of the orthodontist and what they think is going to work best in their hands and what's the best fit for the child. If we notice any concerns, growth and development, the way teeth are coming in, if they have crowding or excess space, and those are all things that we look at, the alignment of the jaws. So we're overall just trying to help children get a lifelong healthy smile and the relationship with their teeth.
Kids usually get their first molars in the back of their mouth around age 6.
Mhm.
So, because of that, you're still seeing the kids typically. Do you work on adult teeth or do you typically refer out if they start getting their adult teeth in?
We do definitely work on adult teeth in our practice. As children get older and more into their teenage years, depending on the extent of the cavity on the permanent tooth, sometimes it is best treated by a general dentist who's going to maintain and follow that patient the rest of their life. There are certain things that general dentists will have more resources for on permanent teeth as well. For example, if a tooth needs a root canal and a crown, there's some of those teeth that, after they've seen the specialist for the root canal, that we're able to place a crown on the tooth, but sometimes it makes more sense for them to go ahead and see a general dentist for that procedure. Also, in general, if they have more adult treatment needs, then sometimes it's best for them to be graduated to a general dentist who can treat the permanent teeth and maintain those teeth for the rest of their life. But we do definitely treat permanent teeth in our office.
If a child has a dental emergency and it's always usually after hours, where would you recommend going? Would you recommend them going to the emergency room or is there typically like an on-call service for most offices?
In our office, we have our doctor's cell phone numbers on our after hours recording so that if any of our patients of record need to reach us after hours for a dental emergency, that they are welcome to do so. So if your child has a dental home and a dental practice, that tends to be the best person to reach out to first is usually their primary dentist so that they can give you guidance if this is something that they are able to manage or if they truly do need to go to the hospital. There are some situations where severe trauma or if they have a severe infection with swelling, in some of those cases, they do need to make a stop to the hospital as well as the dentist, but sometimes the dentist can help you sort through what the best solution is. And if you're obviously ever concerned about if there's ever any loss of consciousness during a traumatic event that damage the teeth or the mouth, it's best to go to the emergency room for those. As parents, if you're at all concerned for their overall health after a traumatic event, then it's best to go to the hospital. You can call your dentist as well to let us know what the situation is, so we can talk you through what we're able to do to help. That's part of our job is being available after hours for our patients of record if they do have acute needs such as pain, swelling, or if a child falls and bumps their front teeth on the playground. That's part of what we're here for is to help families through those situations.
I will say if it's not like a life-threatening situation, I don't believe a lot of hospitals have dentists on call. They would probably have an oral surgeon on call. So it's a good idea to check with the dentist if you can get a hold of them to just
Mhm.
kind of triage and figure out what's the best route for you.
Mhm.
So, what is a lap exam and when do you use it?
Our lap exams are where we will have a child sit on the parent's lap. The parent is facing towards the provider. So the provider and the parent are sitting facing towards each other with our knees touching. The child sits facing towards the parent and wraps their legs around the parent's waist. And then we lay the child back into the provider's lap so that we can get a very clear view of the child's mouth. And we ask the parent to help stabilize the child by holding their hands on their tummy so they don't accidentally reach up and grab something that you might hurt their hands. I always tell them nothing that we're going to do while we're looking is going to hurt their mouth or their teeth, but if they grab something the wrong way, it may hurt them. So we've had the parents help hold their hand. And then the child is also able to see the parent that way. And that's reassuring for them too that their caregiver is present with them. So we usually use those for our infants and sometimes toddlers, that any children that we need to do an exam on and the parents are okay with us using a form of protective stabilization to do a thorough exam and cleaning for the child. But most often it's for the itty bitties, the new little ones that are coming into the office, our 1 year olds and that first come in. They are oftentimes they don't understand going on what we're trying to do for them. It's normal for them to be scared or cry, and just reassuring the parent we're not hurting them, that they are going to let us know they probably don't want us looking in their mouth and who is this person. So we definitely pride ourselves in trying to help every child be comfortable at the dentist, showing them all of the things that we use and how we're going to use them. And then sometimes we'll let them practice using the instruments if it's appropriate for their age. But for the itty bitties or little ones that are not able to sit in the chair yet, it's a great way for us to get a good look and see what's going on and get their teeth cleaned.
What's the best way to prepare a child for their first dental visit?
I think as much as possible, talking to the child in a very positive way about coming to the dentist makes a difference. We have some children that come in and they already have these ideas in their head that it's scary, it's going to hurt. And most of the time, the things we're doing at that first visit are not going to hurt them. And we try to make it, fun and exciting for them, showing them all the things that we're going to use and what we're going to do for the day. I'm really blessed to have a great team of ladies that work with me, the assistants that help our patients feel very at ease in the office, and they kind of help them get comfortable before I come in to do my exam. And then, so I think going in with that positive mindset, encouraging the child that we're here to help you makes a difference too. Sometimes it's nice to read books about going to the dentist. There's some great ones out there, like Daniel Tiger is a great one, and there's others that are out there as well that just talk about the different steps that are involved at the time of going to the dentist's office, and just emphasizing that it's meant to be a positive experience. Another great way to prepare for the visit is to see if there's a website for the office that you're going to. And oftentimes they'll have pictures of the team members or the office, and you'll have the child see who their provider might be or who their team members might be and kind of see what things are going to look like when they show up. And sometimes that helps, prepare children. But definitely a great idea if your child has any special healthcare needs, it's always a great idea to let the dental office know that when you're making the child's appointment, so that if they want to arrange a time for you to come in, even before their visit even happens, just a time for them to come walk through the office and see what goes on there. That can be helpful for the child too. That way they're not coming in right away for their first visit and trying to take all these things in at one time. They've already had an opportunity to familiarize themselves with the environment before coming back to do cleaning and check up in the office.
What are the most common questions parents ask you about their kids' teeth?
I think that probably the most common one would be, when do we need to brush the teeth? We have touched on that earlier. When do they need to come to the dentist? Again, the answer is no later than age 1 is the time to bring them in. There's a lot of misconceptions out there that, where people think that they don't need to bring their child in because nothing's hurting or the child won't sit in the chair yet. That the earlier you start them, prevention and coming in for routine dental visits, the more comfortable they will become in the dental office and realize that this is a positive environment. So I would say that's probably the most common question we get is, when should I bring them in? And a lot of families have heard, oh, wait till they're 3 or wait till they're 5. But sometimes that can be too late for a child. And we'll see patients that come in for an emergency visit because they do have pain with the tooth. And sometimes in those cases, it may be too late to save a tooth.
On a side note, so a lot of parents that I have overheard them talking about, like if they don't have the best oral health and they've lost a lot of teeth or they need to have a lot of teeth pulled, they sometimes will project that onto the kid or maybe even scare them to say like your teeth are going to look like mine if you don't brush or whatever. Do you have any suggestions on like how to encourage a kid to not be scared of their teeth and what can happen?
Yeah, I think encouraging the child that everybody's mouth and teeth are different and that there are some families or some children that will be at higher risk for developing cavities, but we just kind of have to empower ourselves to do everything that we can to work against those cavity causing bacteria to prevent them from doing the damage to the teeth that they want to do. So we focus a lot on diet and oral hygiene in our office, talking about not only what we eat, but how often we eat it. And the way in which we're eating things can make a big difference. No, cavities are caused by multiple factors. Some patients have aggressive cavity causing bacteria in their mouth. Some patients need some assistance with home care, like brushing and flossing to help prevent cavities. Diet plays a big role as well. So I recommend children trying to limit how often they're having sugar and carbohydrates. I'm also a realist that I know that children, including my own children, love sugar and carbohydrates. So it's not that they can't have those things. It's just don't want them to be snacking or grazing on those things throughout the day. So I recommend that we have our 3 meals a day. And then if they do want to have a snack in between meals, let's say between breakfast and lunch, they want to have a snack, you just sit down and eat that snack all at one time and then just switch to drinking only water between meals. Things that are going to be healthier snack choices for our teeth would be things like nuts, cheeses, raw crunchy vegetables, things that are higher in healthy fats, proteins, fibers are going to be way less likely to cause a problem with cavities. But again, it's not so much the quantity of what we're eating as how often we're eating it, right? So like it doesn't matter if we have one little bite of a goldfish or we eat an entire family size bag of goldfish. The bacteria in our mouth that cause the cavities are going to put acid on our teeth for a significant period of time after we've had those sugars or carbohydrates in our mouth. So water is going to be the healthiest thing for our teeth in between meals. If you want to have your child have some milk or juice, I recommend doing that at mealtime only.
And do you have any recommendations for if you do need to give a child a shot to numb? Is there words that parents can use to get a child ready or words not to use?
Yes. So we try not to have parents use those words at home. So sometimes when children think of a shot, they think of getting their immunizations at the doctor's office. And this is a little different procedure here. So I try to focus on telling the family to, sometimes I find it helpful to not make a huge deal out of it at home. And you can welcome your child to, ask the dentist if they're asking you questions that you're not comfortable answering, or it's like, are they going to give me a shot? How much is it going to hurt? Say, that's a great question for your dentist. And, we can kind of talk them through that. But I usually focus on telling the child what they're going to feel so that they trust us and know that we're not going to lie to them about how things may feel during their procedure. But we don't want to scare them by showing them, necessarily all the instruments that we're using, because some of them can look more intimidating than what they actually are. But we try to be as gentle as possible. And we do have some patients that are like, oh, is it over? Did you do it? They don't even know that it's happened. So sometimes children will kind of ruminate on the negative things ahead of time and get themselves worked up before the procedure. A lot of times when I see children in the office and I recommend that they come back for treatment, just a simple way of explaining is your tooth is going to go to sleep for a little bit while we're working. It's going to feel really weird for a couple hours and it'll wake up after we're done. And then if you have any questions when you come in, we can write them down or keep them up here and we're happy to answer that for you. And we'll talk you through every step of the procedure. So I find that some of the words can sound a little scarier to the child than what it actually is.
Using words like sleepy juice instead of a shot or something like that.
Yes. Yeah, exactly. Yeah. So just some of those words where it's like we want to build trust and we don't want to lie to them, but there are other ways that we can explain things to them that don't have that fear attached to those words. So shot's definitely a word we try to avoid using in our office.
What is the oldest kid that you have seen that didn't have teeth? And then what is the youngest kid that you've seen with?
Youngest kid that I've seen that did have teeth was a newborn that had natal teeth. So sometimes children are born with with teeth that have already come in, or they will have teeth that come in very shortly after they are born. So we do see those children in our practice. Say oldest patients, there are some children that are over a year old before they even get their first tooth that comes in. If you're ever concerned about, your child's growth and development with their dental health, it's always a great time to reach out to your pediatric dentist in your area and ask them if when the child should come in, if there's anything that they need to be concerned about. But again, establishing that early relationship with a dentist, no later than age 1, can be really helpful in giving that anticipatory guidance for what's normal and not normal.
My oldest I've seen is like almost 2, and there were other things that they were a little bit delayed on, and so everything was, like, tracking with the developmental technically the age.
Yeah, absolutely. Yeah, their dental age may not match with their biologic age.
Any myths about baby teeth you wish to debunk?
Baby teeth are very important not only for chewing function, but holding space for the new permanent teeth that will come in. Cavities left untreated in baby teeth can also damage the permanent teeth. So if a cavity gets into the nerve of a baby tooth, it will start to cause pain or infection. And the little permanent tooth is sitting underneath the roots of the baby tooth. So when there's infection with the baby tooth, it can go down into the bone and start to damage the permanent tooth that's underneath. And it can actually cause something called hypoplasia or malformation of the enamel of the permanent tooth. And there's other complications that can come along with that as well. Sometimes it can even lead to loss of the permanent tooth.
If a kid is grinding their teeth, is that something that they should visit you or should they go to their pediatrician?
So I think both is a great solution. So whenever we see a child where the parent mentions that they're grinding their teeth, sometimes that can point towards an issue with their airway. And so we will ask other screening questions like, does your child snore routinely or stop breathing at night? And so we always encourage them to discuss any of those things with the pediatrician as well, so that if they need to have a sleep study or be seen by ENT, if there is an issue with their airway, like if tonsils and adenoids need to be removed to improve their sleep health at night. Another thing that we'll ask is, is your child restlessly sleeping? Do they seem tired during the day? Do they not seem well rested? Those are all signs that they may not be getting good sleep quality. And sometimes we'll see that come out with grinding of the teeth. Other times it's what we call a parafunctional habit, where there's not really a great reason for why they're grinding their teeth. Their body's just kind of programmed to do that. Some kids will grow out of it. Others that do not outgrow it may benefit from having a night guard. We usually recommend night guards in most cases when they're more fully grown. We ideally don't want them wearing an appliance or device that could potentially modify or restrict growth and development if they're wearing it all night. But once they're an adult, if they're still grinding their teeth, then that can be a very beneficial tool. If parents do mention that the child is grinding their teeth, then obviously that's something we'll want to monitor every 6 months at their checkups to see if it's doing significant damage to the baby teeth or the permanent teeth. And there's solutions to help minimize that. And thankfully, baby teeth tend to be pretty resilient when it comes to wear, but some children have very severe wear and they can actually wear through where they almost or do expose the nerve of the tooth in more severe cases. So definitely something to mention to your pediatric dentist and pediatrician. And if you notice that your child is grinding their teeth, so you can take a deeper dive into what might be going on there, and or if there's any damage that is occurring with that.
And if they're seeing a general dentist too, it's possible to get a referral even to like an orthodontist for them to see if they need
Mhm.
some expansion early to see if that would
Right.
help.
Sometimes an orthodontist can be a great resource in those cases as well, and because sometimes they have resources to be able to improve the health of the airway as well.
I kind of asked this question earlier, but what would you say to a parent that says that they have bad teeth? So the kid will have bad teeth due to genetics.
Potentially make the child at higher risk for cavities, but it doesn't necessarily mean that they're destined to follow the same path. That, with good routine dental visits every 6 months and committing to good oral hygiene and diet practices at home, those things really can help make a difference. There are some conditions with the teeth that people more disposed to getting cavities, if their enamel doesn't form properly on the teeth, things like that. And there are some less common genetic things that can occur with the teeth, but by and large, there's a lot that can be done to help prevent cavities on for children.
Alpha gal is becoming a pretty big problem in Missouri and very popular with patients. What is something that parents should be aware of if their kid does have alpha gal while going to the dentist?
We want to make sure that we're not using any, animal products for those patients. That way, we're not exposing them to any potential things that may cause a reaction for them. But definitely an important thing to, let any healthcare provider know that's going to be treating you, whether or not you think it may affect their dental health. Sometimes, they'll think, oh, well, that doesn't affect the teeth. We don't need to mention that. But you'd be surprised what can affect our treatment. We have a very in-depth medical history, and we have a spot to put comments for things that you don't find a spot on there, but more information is always helpful to us to make sure that we can keep your child safe when we're doing treatment.
And having parents ask about like even the prophy paste that we use to clean kids' teeth or like the topical jelly are things that can potentially have animal products in them. It's
Mhm.
crazy what people they can find, but we can always look up what the ingredients are.
Yeah, absolutely. So one of the reasons that I chose the prophy paste and the fluoride varnish that we use in our office is because I contacted the company and they said it is safe to use on patients with alpha gal. So and it's free from all of the like major allergens. So it's just nice to know that we're not exposing children to those things, those more common allergens.
Even some fluoride varnishes, even though they're clear colored or white, they still can have like red dye in them. So if your kid has any allergy, just verify that what we're using is safe for them.
Yes, yeah, any allergies at all are very helpful and crucial for us to know about.
What's one piece of advice you'd give every parent about their child's dental health?
I feel like I'm, saying this over and over, but really it would, I think it would have to be that I highly recommend bringing them in by age 1 to see the dentist and making it a point to consistently have checkups every 6 months. Just early routine care makes such a big difference. So that would be my, biggest piece of advice or take home for parents is, get them started early with a dental home.
Awesome. And where can people learn more or contact your office?
Yeah, so we have an office website, Pediatric Dentistry of the Ozarks.com. You're also welcome to call our office, and one of our patient care coordinators are happy to help you with any questions that you have or scheduling an appointment for your child. We're always welcoming new patients. Fun fact is that you don't have to have a referral to come see a pediatric dentist. We do have a social media presence on Facebook and Instagram as well. You're welcome to check us out there also.
Dr. Taylor, thank you so much for sharing your time, expertise, and passion for pediatric dentistry with us today. I know parents watching are walking away with a clear understanding of how to set their kids up for a lifetime of healthy smiles. If you learned something new today, hit that like button, drop a comment with your biggest takeaway, or if you have questions for Dr. Taylor, comment them below. Don't forget to subscribe so you don't miss our next episode. Together, we can make every dental visit a positive experience for kids and parents alike.